Friends, welcome to Happy Nursing. This is Ila. Today we will discuss one of the important aspects in healthcare, the end of life care. Friends, you may have encountered many families having a terminally ill member. What is meant by terminally ill? Terminal illness, which we also called as end stage disease, is a disease that cannot be cured and is expected to result in the death of the patient. For example, cancer, dementia, advanced heart disease and other progressive diseases like congestive heart failure, pulmonary disease, renal failure, etc. Now, every family having such a member among themselves have different coping processes. A nurse's job is to support them through their grief by providing adequate information, being realistic but sensible, providing privacy and allowing them to take time for saying goodbye. Palliative care is a term which often comes across in our mind while discussing end of life care. Palliative means relieving symptoms without dealing with the cause of the condition. This care is for such people who are eventually going to face the end of life and their disease cannot be cured completely. That's why concentration is given on relieving the symptoms so that the patient can be comfortable throughout the course of the disease till the end of life as much as possible. Now we must understand that palliative care is not only for end of life or for the patients who are actively dying. This is to help the patient live the remaining days of life comfortably. Actively dying means those who have a few days to live. It is important to understand this difference because sometimes it happens that patients' family members don't agree to take palliative measures because they think there's nothing more to do for the patient, so they want to go for more aggressive treatments. But let me tell you friends, once you are experienced in this field enough, especially if you have the opportunity to work in a palliative field, you will see many cases where palliative is the best measure you can take. Going for aggressive treatments will further shorten the lifespan of the client because he or she no longer has the ability to withstand the toxic effects of escalated treatments. Whereas palliative treatment can help him to live longer compared to the former and with dignity, with the symptoms relieved. Now we will discuss some interventions related to palliative care and end of life care. First one is use therapeutic communication. Communication is the basis for palliative care. Patients during this period generally remain engrossed in a mixture of emotions like sadness, anger, denial, etc. They may become angry at trivial issues, some may become demanding, some may accuse us of something all of a sudden. I don't know whether you remember or not, I told you in the video of Gene Watson's theory of human caring that we have to facilitate the expression of feelings of the client. Here also we should do the same. Some clients may not be ready to share their feelings. The reason may be anything, out of fear, for personal reasons, or they may think people will isolate them. We just need to assure them that we are always available for them whenever he or she is ready. We should avoid giving false assurance and accept the grieving process as a necessary part of the client's adjustment. We can keep other options in front of the client and his family also, like seeking advice from spiritual care providers. Next is provide psychosocial care. Clients at the end of life experience a number of psychological symptoms like depression, altered body image, denial, powerlessness, etc. Most of them suffer from an uncertainty, which gives rise to anxiety. Therefore, during this time, the responsibility of a nurse is to provide information about the disease course, the benefits and side effects of treatment and outcome. This will reduce their level of uncertainty. Next is manage symptoms. The most predominant symptom in dying clients is pain. Often narcotics are given along with analgesics in the chronically ill patients for their pain relief. Before administration, proper assessment is needed because some analgesics and narcotics have side effects also. For example, tramadol hydrochloride can cause nausea, vomiting and dizziness. Overdose of morphine, which is a narcotic, can cause dizziness, constipation, itching and respiratory depression. Some narcotics can cause addiction in patients also. So before administering them, we have to assess the client's pain properly. Many clients often lose their ability to communicate. In those cases, we have to use the communication board to assess the pain. Added to that, patient should be assessed from time to time for the side effects and doses should be modified accordingly. Other than pain, Symptoms like fatigue, anxiety, skin discomfort, constipation, urinary incontinence, diarrhea, altered nutrition, etc. are also present. These symptoms should also be managed. For example, basic care including oral care, eye care, applying lubricants or eye drops, etc. can be done for skin and mucous membrane discomfort. Laxatives can be given for constipation. Small frequent diets should be given as per patient's choice to maintain proper nutrition. Some of the non-pharmacological measures also work, like allowing the patient's relatives to provide selected cares, making special permission for them to be with the patient for some extra hours, etc. Next is promote dignity and self-esteem. A client's dignity and self-esteem reflects on his physical appearance, especially when he or she becomes dependent due to the disease condition. So, we must be attentive towards their cleanliness and clothing. We should consider the client's choice while providing care, provide privacy to the client and his family members, and show respect to the client's decisions. Next is maintain a comfortable and peaceful environment. A comfortable, clean, pleasant environment helps the client to relax, promotes good sleep patterns, and minimizes anxiety. Client should be provided such an environment through giving him comfortable position, keeping the bed linens dry, and keeping noise to a minimum in and outside his room. Mild comforting music can also be used in the room if possible. Next is promote spiritual comfort and hope. Nurses can collaborate with the client's own spiritual leader and community and help them to connect with them. Literally speaking, the client has no hope, but the reality is we can make him experience hope in different ways. For example, in the midst of medication, procedures and medical staffs, many clients have simple tiny wishes in their minds, like going out for a walk, to meet someone for one last time, or to have a peaceful death. We should help them to achieve those goals. Next is protect against abandonment and isolation. Most of the clients, when diagnosed with a terminal disease, often suffer from hopelessness, that everyone will leave him or her, he or she will die alone, etc. This gives rise to fear of abandonment. For such clients, nurse's presence is very helpful. We should assure him that we are always available. Attend to the call bells as fast as possible. Place the client in a sharing room if possible. Otherwise, allow the family members with them to provide simple cares like offering food, combing hair, etc. Next is support the grieving family. Family members of palliative clients are challenged by the process of caregiving. They often feel stressed and exhausted. They can be helped through respite care services or hospice care, where family members are allowed to rest for some time and attend to other jobs, while healthcare providers attend to the client. Besides that, family members should be educated regarding the symptoms client is likely to experience. It will make easier for them to accept the symptoms when presented. Next is assist with end-of-life decision making. Clients and family members often face problems deciding several aspects, like whether life-extending treatment should be stopped or continued, should artificial nutrition be used when a client is near death, etc. They need to be explained clearly and assisted by the healthcare providers. Conversations need to be made regarding their wishes, and the client should be included in that. Client should be able to clearly decide a few aspects, like whom does he want to make his healthcare decisions if he is unable to do so, what medical treatment does he want or doesn't want, etc. Next is facilitate mourning. Not only the client but the family members after the death of the client should also be helped to mourn. Discussing about illness, when and how was it discovered, and other related topics will help the family to accept that the loss is real. Encouraging establishment of new relationship and involvement in group activities can also help. Enough time should be allowed to grieve. Next is the last one. The last intervention is care after death. Once the death has occurred, documentation should be done. Some clients willingly agree for organ or tissue donation before their death. For them, appropriate measures should be taken. Otherwise, the family members can be asked for organ or tissue donation. They should be explained the process clearly and given time and space to decide. So that's all about end of life care. I hope it's clear to you. If you like this video, like and share this video and subscribe my channel. Thank you for watching.